Senator Erickson, are you on the call yet? Let's just give it one more minute then. All right. I'm going to get started. Can everyone hear me okay? Good. Hi, I'm John Paralisi. Just to introduce myself, I am the Spark Project Director. I came on board in December to help structure the process as well as to lead and facilitate the process over the coming months. Just a few things. One, just so everyone's aware, this session is being streamed and recorded. And secondly, we'd just like to set the ground rules in terms of, talking during the course of this, fine, as we walk through the slides with anyone, asking a question and having discussion. We've built in points for there explicitly to be discussion as we go. And certainly at the end, we actually have a collaboration exercise once we've gone through the materials for the panel itself to be able to decide, the key areas of need, the areas where we want to focus the process going forward. And within that context, my role for this really is as a facilitator. I am not a subject matter expert on any of these subjects. Really, it's the advisory panel, you yourselves are really the experts that have been brought together to apply your experience, perspectives, knowledge against this to make sure that we focus on the right things and come up with the right solutions. You'll see we have a couple of areas that we'd honed in on around the pre-reads, but certainly we can go outside of those areas as well as a panel going forward if the group decides it warrants it. And with that, I guess the last thing I'd say is just acknowledge that I know that, everyone on this call and on the panel is super busy and, everyone has a day job. So really, really appreciate the time and commitment everyone is placing on being part of this effort. In terms of the agenda, 5 components, the overview is really focused around just helping people understand the purpose of the panel, doing some introductions, continuing to talk through some of the rules of engagement. The second part is the context, particularly around the funding to date. What are the areas that were at least a focus, a core focus at the start of this in this particular panel. Discuss the current needs and gaps, align on those needs, and then really do a review and talk about next steps. Next slide. So anyone who is in the orientation sessions, which is probably most of you, is familiar with this slide and this funnel. The goal of the panel is to really understand the critical needs in health and education, and brainstorm and source and consider opportunities for impact. And the way we constructed the process was that those ideas could come from numerous sources. Research on what other states are doing. We put a lot of that information, at least at a high level, in the pre-read. We can do more work on that as we continue. Needs assessments, And also just internal, external interviews and the work that's been done to date in terms of things like listening sessions and looking at other proposals and submissions that have come in for well over half a year now, as well as submissions that come in through the submission form that was launched a couple of weeks ago. With regard to that, there isn't a huge window for those submissions to come in, but we've actually had submissions coming in one form or another for months. And so even on the ones that have previously come in, we're working with the people who submitted them to make sure that we put them in the template for that submission form, just so that we're able to make apples to apples comparisons across all the ideas submitted. But then finally, a last area where we would expect a lot of ideas to be generated from is this panel itself, because once again, everyone on this panel is an expert in at least one part of this area. And the goal is that after seeing the submissions as well as information that's been provided or any other information we can get through expert sources or discussion, the panel itself will probably identify some opportunity areas and we can flow those into the process as well. So the goal is to be expansive in terms of what we're looking at in the brainstorming, and then filter down so that we make sure that we're really looking at the ideas that are viable based on allowability constraints from the federal government, as well as in the context of what the SPARC committee itself has put forward in terms of guiding principles. Then once that set of viable ideas are there and identified, we can score them and rank them based on things like impact and feasibility and equity, so that we can have an understanding of how the viable ideas stand in relation to each other. And then that last step that we'd envision the panel would take would be to kind of create a portfolio of maybe grouping the ideas or going back and looking at the list and seeing if anything is missing to enable some of the ideas. So for instance, something might be the 15th highest scoring idea, but it actually is something that's an enabler for most of the top ideas, in which case you would want to include that in the proposal. Then the proposals would go from each one of the advisory panels up to the SPARC committee, where the SPARC committee itself will be getting 4 sets of proposals, one from each panel, and need to make trade-offs itself. One last thing to note here, I mentioned before, is that all of the numbers here are totally illustrative. These aren't the targets that we're looking at in terms of ideas. Really, this was just to give people a feeling for, how the ideas would be flowing through the process. Next slide. As I mentioned, in terms of the guiding principles, and this is something we just want to make sure everyone has really kind of top of mind as we go through the process. The SPARC committee, early on in the process, had created a set of guiding principles about how they think about the process and the types of investments they'd like to see for these funds. And a really important one for the SPARC committee is prioritizing sustainable programs and investments through one-time use of funds versus, substantial expansion of existing services. So I know that is a primary focus of the SPARC committee about what they'd like to do here. Second one is, since these funds are more discretionary than a lot of the other funds that the state has seen, to really focus on maximizing these funds. So looking for synergy with other funding sources, and also, really understanding what's the sweet spot for these funds, given all the other funds that are in play. The third one, probably even the most important, really is fostering long-term systemic impact for Kansans. A lot of the previous funds have really been focused around dealing with the COVID emergency and putting the state on an emergency footing. These funds provide an opportunity to think more strategically over the long term in terms of something that could, change the future for Kansas and Kansans. Consider equitable outcomes as we go through this, and really the allowability requirements from Treasury actually pushes you in that direction anyway. Enable flexibility with investment strategies, and part of that is that in some areas, an idea could look like a very specific project, but in a lot, they'll probably look more like programs. And we just need to be flexible to understand there may be some different types of ideas coming out of this process. And finally, these are super important investments, ensuring that the results are measurable and we track them and there's transparency, as well as making sure there's transparency in this process. Hence, why all the Spark committee meetings are being recorded and streamed, as well as all the advisory panel meetings. On the next slide, great. This is where we wanted to, give a chance for the chairs to be able to have everyone on the committee introduce themselves. So I'll hand it over to the chairs for that.
Good morning, everyone. Can you hear me? Renee Erickson.
Yes.
Good. Great. Well, I just want to say welcome to everyone. I look forward to working with you all. I know that this process is new to a lot of us and it seems overwhelming, but we're in good hands with John and his team. And I know as we go through this, it'll make a lot more sense and we'll have a lot more questions. But I am a senator from Senate District 30, which is East Wichita, chair of the Commerce Committee and Education. So just once again, look forward to working with all of you.
Good morning. My name is Robin Chadwick. I'm serving as the vice chair for this panel. I also live in Wichita, and I serve as the president of Ascension Via Christi St. Joseph campus. And St. Joe is where we have about 100 private rooms for behavioral health. So that's kind of my area, and my background is behavioral health.
Representative Williams. Senator Sykes.
Hi, I'm Dinah Sykes. I serve from Lenexa, the 21st District, so Lenexa and Overland Park. I'm also the Senate Minority Leader, serving as ranking on education and Senate oversight and redistricting. So looking forward to working with all of you to get these dollars out to our community. So thank you.
Great. Raphael, I'm embarrassed. I've had to pronounce my last name for so many people over the course of my life, but I'm not even going to try and pronounce your last name right now.
That's okay. Good morning. Raphael Wawasik. I currently serve as a member of the Prairie Band Potawatomi Tribal Council and have a background in federal health grants. And so, yeah, thank you. Glad to be with you all this morning. And I apologize. I'm currently at a remote location. My oldest son is on a school visit, so I'm borrowing an office space right now. So thank you.
Awesome. Dr. Collier. McLean Macklin.
Good morning. I apologize. They picked right now to test the fire alarms in the building. But McLean Bryant Macklin, I'm the Director of Policy and Strategic Initiatives at the Health Forward Foundation. We are a regional public health convergence foundation operating in both Kansas and Missouri. Our Kansas footprint includes Allen County, Johnson, and Wyandotte counties. We grant make to the tune of about $27 million, about half of which goes out in each state. And just looking forward to lending some health acumen to these conversations and like everybody else, getting these dollars out to Kansans.
Kathy Decker. Sean Sullivan.
Good morning. I'm Sean. I'm the president and CEO of Midland Care Connection. Midland Care is mostly a community-based provider. We serve 22 counties in Northeast Kansas, so Topeka, Lawrence, KC, Emporia areas, and serve those roughly a little short of 2,000 seniors, mostly seniors. We do that through a program called PACE, which is a program of all-inclusive care for the elderly, a provider-based managed care system for people that are at risk for going to nursing homes. And also do that through home health, hospice, palliative care, Meals on Wheels, and a number of other services. And my background is in long-term services and supports, both as a provider and then also spent a number of years in state government, including as the Secretary of the Department for Aging. I'm glad to be with you all. Thank you.
Great. Thank you, Sean. The other thing I'd note is that we have several other folks from the support team who are on the call representing the recovery office, KLRD, consultants from Widow O'Brien's and BCG. So I'll talk about it a little bit later, but one of the things, given the speed with which we're moving, we are making sure that this process is incredibly well supported. Once again, realize everyone has day jobs, and even on setting a time for this session, when we looked at people's availabilities, we knew some people would not be able to make it. And our commitment is, since there's probably not going to be a meeting where someone won't be able to make it, is that we'll work with whoever could not make the session to make sure that they do not miss a beat. And that's another benefit of recording each one of these sessions. On the next slide, I talked about this a little bit on the orientation. I'll just kind of talk about it briefly again, but this slide is great in that it looks comprehensively at the entire process, and it's bad and because it's really complex as a result. But if you just go down underneath the advisory panel row and look at meetings, basically kind of the cadence for each one of the advisory panels was to do that group orientation and then start with kickoffs. And this is the third one we're doing. We're going to have the fourth one later today in terms of the advisory panels. And then each one of the panels over the course of February and March is really going to be working through a process to identify areas of need, identify ideas and opportunities, as mentioned before, going through the funnel, focus in on the most important ones and put together a recommendation that the chairs would present to the SPARC committee in early April. And that would give the SPARC committee some time to have some iteration both within the SPARC committee and then between the SPARC committee and the advisory panels, because we'd envision that there would be some requests or clarifications asked for as the SPARC committee works on coming up with an integrated proposal to go to the State Finance Council in early May. One thing to note in terms of setting expectations is that the thought is that there's going to be more across all the advisory panels going to the SPARC committee than will be able to be funded and what remains in the SPARC funds that can be allocated. That's by intention. One of the things that had been mentioned early on is, every proposal can look great and is really important in and of its own right when you look at it, in isolation, but would like to, for these set of funds, when they're saying yes to something, the SPARC committee would like to understand what they're saying no to. So getting kind of a good portfolio of really high priority opportunities allows them to kind of have that visibility so that they can understand the trade-offs that are being made when they decide to move forward on something. The other thing to keep in mind is that even if something doesn't get funded out of this process, those ideas are still going to have been defined and could get funded in a number of other ways as well. Next slide. Once again, I'd mentioned, multi-step process. And on this one for the kickoff, the goals mainly are introduce the panel process and the plan and the engagement model, build that shared understanding of current needs in Kansas, and align on kind of what we're solving for, which, as I mentioned, that's going to be much more of a collaboration exercise, to make sure that we're getting, everyone involved and discussing things by the end of this process. On slide 7, this is just putting this process in context, in context in a little bit of a different way. The industry that I've spent a good amount of time on over the last 15 years is the construction industry. And, since everything that we built from a commercial construction standpoint was new and unique, the only thing that we knew for sure was that the plan we put together, no matter how good on day zero, was going to be obsolete some way on day one. And the thing that really separated successful projects from ones that weren't successful were the ones that were able to see where they needed to be, make adjustment pretty quickly and make those adjustments. And, I think in some ways this is kind of a similar process because this is a new way of doing things. First time we've tried this process. And so what I'd say is, I'm sure we're going to need to be able to make some adjustments to it, no matter how well we planned it out, and be adaptable. So would ask, and we're going to have with that in mind, we're going to have an exit survey at the end of this that we'd ask all of you to fill out to say what worked, what didn't work, where might we need to adjust. But keep that in mind. We just ask for some flexibility and some grace as we go through this, as we kind of adapt as we need to. One other thing that's pretty specific for this panel, and each one of the panels is a little different. Health and education is a super broad topic. It has some less defined scope, although, we focused in on a few areas, but once again, the panel can go a few areas in terms of the pre-reads based on, previous guidance and what we'd heard from some listening sessions. But also a lot of the things here, fit closely within the allowability constraints, but at the same time, may be hard to solve when you look at some of the guiding principles from the Spark Committee. So definitely as we think about allowability and balancing, kind of those two sets of guidance, there will be probably a little bit of discussion and creativity that needs to come to bear during that. Last thing is, panelists, we should strive for consensus by the final recommendation, but realize that over the course of this, there's going to be a lot of discussion and people coming at things from different perspectives. And so, and debates, and that's all going to be great. In terms of some rules of engagement, then I'll be done with the last section. Once again, realize this is, a huge time commitment for folks because everyone has a day job. Generally what to expect, and you saw it probably from the meeting structure, is 2 to 3 formal meetings a month that would each probably be about 2 hours long, similar to this setup, with some homework in between and potentially even maybe even some webinars to the extent that we bring some experts in or do some more focused work based on the direction of the panel. Once again, panels should come ready to engage. The only thing that we would ask at the end is, we realize that since everyone's being brought in as an expert, there may potentially be some conflicts of interest along the way. Just if you think there may be one for you, just flag it and abstain from voting if something's like very specific to your organization. Otherwise, your organization certainly can submit ideas and requests. So just wanted to kind of point that one out. And in terms of support, as I mentioned before, we bring a lot of support and resources to this because we realize that this is a pretty fast pace. Everyone has a day job. And at the end, we're going to point everyone towards a team site, which will hopefully make the panelists' lives a little easier by storing, all the information that you need there, as well as all the contacts that you can pull on over the course of the project. So that's it before we get into the next session around the context, which covers funding to date, the landscape, and even some of the thoughts around which led us to, focusing the pre-reads in a couple specific areas. But anyone have any questions or thoughts before we move on? Great. Well, I will move on then. So just to put this all in context, there have been a number of sources of funding to date in Kansas over the course of the last couple of years. And what we're talking about here is the state level funding of about $1.6 billion. There's also local funding of $1 billion, and there may be some synergy between those sources of funds as well as others. but 1.6 billion, that is the primary focus of this effort. And by the way, a lot of the other sets of funds have gone into the education and healthcare ecosystems because there are a huge amount of needs, and particularly given the COVID emergency. Not to say that every need was solved or anything like that, but that is a kind of a context to think about as we walk through this process. And on the next slide, really focusing in on the right was that, when you look at what remains to be allocated here, because, this process started, in the middle of last year, and $869 million worth of the 1.6 billion has already been allocated or promised in some way or another. So we're largely focusing on 731 million in funds. And so this is, and it could grow over time depending upon what happens in some of the areas where the previous allocations were made. But that is kind of the overall pot of funds that we're looking at here. And this is the pot of funds where the goal was, let's really look at them in an integrated sense so we understand the trade-offs that we're making. This slide really talks about, okay, when you look at the areas where, funds were allocated previously, not that they've all been spent or anything like that, but allocated, in the 869 million, a number of those areas, even within the Spark funds, have gone to the healthcare arena as well as education. Healthcare, for instance, in the nurse and frontline care workers retention program, which was 50 million, as well as the learning loss grants in the education area, which was also for 50 million. So some of the funds, that have already been allocated from Spark have gone into these areas as well. And that leads into, the overview of, when we talk about each one of these advisory panels, trying to provide maybe a little bit additional definition and transparency around areas of focus. Partially because, as well, looking at an integrated sense, because there are some needs in one panel that could be big drivers for another. So from an economic revitalization standpoint, things like childcare can be incredibly important from the standpoint of driving the economy, as well as just kind of generally, health and education could be pretty important factors that individuals look at when deciding whether to relocate to Kansas, or companies could look at when deciding whether to relocate to Kansas. So, and since, Common Support Group is going to be facilitating across all the panels, we're going to, focus on those things to make sure that the right level of coordination exists. On health and education, the core focus that we went into this with from a support group standpoint was around behavioral health, early education and childcare, and then maybe a little bit of a secondary focus around essential needs. There are a lot of other areas we could have focused. Part of that was driven by, and I wasn't around for this, previous sessions of the Spark Committee, and where some, areas of interest came from that, as well as from some of the listening tours. Once again, we'll go through the slides as we go, and you're all experts in this arena. And, you guys can kind of take this where you think it should go based on your perspective, being more on the ground. A little bit more information on the next slide around some of the kind of filtering considerations around, particularly behavioral health and early childhood development. One is, high level of need. There is a lot of information in the pre-reads, but these are areas where there is a lot of need. And in most cases, the pandemic compounded the need. And there are areas where Kansas hasn't traditionally benchmarked well against other states. Sure, there's a lot of progress that's been made and focus on those areas, but still critical areas for Kansas. Limited funding in terms of the funding that's come to date has been focused on those areas, relatively speaking, at least, and clear allowability in those areas. So just something to kind of keep in mind around why the focus may have focused in more on those areas. But once again, the panel can take it wherever it wants to go. Next slide. Oh, sorry, go back to slide. There you go. So, behavioral health, early childhood development surfaces, early focus of the panel. We outlined here, I'm not going to go in detail around, why some of that focus may have been there, in terms of all the areas are highlighted in terms of the Treasury guidance in terms of being allowable to various degrees. But once again, public health and K through 12 education have gotten some decent amount of focus to date, not that all the needs for sure have been solved. Maybe a little bit less focus in the behavioral health and early child development arenas, and certainly some significant needs. Next slide. So with that, this is where I, as the non-subject matter expert, once again, will go and just provide some highlights around some of the information in the pre-reads, which were focused primarily around behavioral health and early child development. But before I get into that piece, and we're tracking way ahead, which is great, because that's going to mean that we're going to have a lot of time at the end to discuss this. But before I go into those slides, any thoughts, questions, comments? Great. Okay, on this slide, this on the behavioral health slide really just outlined some data benchmarks around the situation around behavioral health in Kansas. Most of you are probably familiar with this, but certainly an incredibly important issue with negative trends in all states. But Kansas in particular, has this as an area need, even when benchmarked against other states. For instance, when you look at the 51st across the 51 states and DC in unmet treatment needs. So lots more data that were in the pre-reads, but this was just kind of to highlight some of the situational, high-level situation in the area of behavioral health, which once again has been an important area across all the states, and an area that most of the states are really trying to focus in on in terms of addressing those needs and considering where they spend some of these funds. Second slide, once again, looks at it, how the issue in behavioral health intensified during the pandemic for everyone. And one thing to note is that all of these pieces of information, except the 25% more drug overdose deaths in Kansas, they're all across the entire nation. So it's been an issue everywhere, but also a particularly big area of need for Kansas. And as I mentioned before, on the next slide, when you look across prevention and promotion, the system enablers, treatment and recovery, capacity, workforce, affordability, a number of states have been focusing significant funds against those areas. And this is an area where we have access to, at the very least, where states have been earmarking investments with these funds to date. So we can bring more targeted analysis against this to you. One thing to note is that a lot of states are in the same situation Kansas is in, and they are in the middle of thinking about where to focus as well. So, these examples are by no means going to be kind of the final set of examples of where states focus on behavioral health by the end. So just threw out some ideas here for, potentially things to think about, going forward around potential areas of focus, even just within behavioral health. So for instance, on prevention and promotion, investing in prevention promotion activities to stop and minimize mental health problems before they emerge, social determinants around basic needs and addressing those, treatment and recovery, closing service gaps in the continuum of care, offering more options, workforce, recruiting, retaining, developing behavioral health workers across Kansas, affordability, on the system enabler side, systems integration of behavioral health services, and data and IT side, build the infrastructure needed to support behavioral health care access, treatment, and integration. Once again, I'm sure that most of you who are in this space are aware of these needs and opportunities, and so this was just tagging some things to get people thinking as we go forward. Before I go into early child care and development, any discussion around this area?
John, I would just comment that I think the slides that you've shared and certainly the information in the pre-reads that were sent out really paint the picture of almost a dismal state of affairs of how we have addressed behavioral health needs across this state. And so I think our committee or our team has a really good opportunity to make some great recommendations for how we can do better, because I do believe Kansans can do better.
Great, thank you. Any other thoughts? And like I said, at the end, we're going to have plenty of time for the group itself to kind of discuss, debate, as a group, prioritize, areas of focus. So, so this discussion will obviously continue probably in about 30 minutes or so. Go to the next slide, and I'll go through once again just some highlight details around early childhood development. Once again, looking at this area, there are kind of ways of thinking about how to break down the opportunity and the problem, looking at basic needs, because, addressing those needs really does impact, childhood development as much as it does behavioral health, access and availability around basic needs. Then in childhood development, particularly childcare providers, thinking about workforce and operations. So thinking about the supply side, childcare providers have struggled to maintain operations pre-COVID, even before all of this, due to the thin margins. Kansas home-based provider pool has been declining year over year for a while. And they all have seen increased financial and operational strains over the last 2 years on top of that. From a workforce standpoint, workforce facing downturn due to aging, as well as the thin margins that already existed, workforce struggling to meet their own needs, can impact their ability to deliver care. From a systems enabler standpoint, given the thin margins, hard for at least individual providers to be able to focus as much on quality. And then just like in the area of behavioral health, from a system alignment standpoint, it can be a complex landscape for everyone to try and navigate. Next slide. So this slide is a summary slide that looks at the spending per capita on childcare in 2018. And this is, I believe, a aggregation of federal and state level funds around childcare. So this isn't meant to obviously represent individual contributions to it. But you can see from here that Kansas is pretty low on the list in terms of child care assistance per citizen. The next slide really just highlights, when you look at from a child's perspective, where the most development occurs. It really does occur the most in the early years, certainly kind of 0 through 5. And that's where less of the spending has gone in terms of support in general, and also in Kansas as well. So maybe a lost opportunity for sure around being able to place some of the children in Kansas on the right path. And then once again, and we'll be able to get more information on this. This is an area where other states have started to focus their efforts in terms of making investments around shoring up and enabling, this enabler for their economies, as well as for the health and well-being of children. So on the next slide, in summary, some of the areas to maybe think about, just to kind of, germinate some thinking on the panel's part around early childhood development, around basic needs, improving the wraparound supports, obviously is an area that could, generally raise a lot of votes. Access and availability, increase availability of early childhood care and services for families. You can look at this structurally, for instance, on creating new providers or expanding capacity, but also things like reducing administrative barriers around capacity building. Workforce and operations, ensure existing service providers are equipped to sustain operations, and workforce development, grow that workforce. And then from a system standpoint, continue to improve the quality and strengthen that systems infrastructure and align efforts across Kansas local and state level early childhood organizations from the top down. So kind of a more kind of coordinated approach or integrated approach to it. So before I move on from here, any kind of summary discussions or thoughts around this before we start getting into kind of the broader discussions? Great. Go to the next slide. So, we're well ahead of time, which is awesome. So the group will be able to have some really good discussions around kind of generally the situation, where we should focus. And even in kind of the areas, the broad areas to focus, what are some of the sub areas that probably could present the greatest opportunity. So go to the next slide. So, and this is an area I'll actually let the chairs facilitate this, but, as we look at these broad areas, how do people think about behavioral health and early child development as being kind of a core area of focus? And how do we think about that kind of in the context of, everything else in the space that could be an area of focus?
Well, thank you, John. I appreciate that. It's Renee. And I'm going to let Robin jump in here. This is her area of expertise as far as the behavioral health. And I just want to reiterate that to John's point earlier, that these are areas of focus, but by no means limiting us to the areas that we can explore. So Robin, do you have some input?
I would just be interested in the people on the committee. What are your thoughts about behavioral health? I mean, we've got some ideas listed out. You've seen the information in the pre-reads, but from your experience, your knowledge, and your understanding, what are we on track here with these ideas, and what other ideas would you have?
So I can start. From what I've been hearing, we're on track. And just to share, my context has been, I'm also on the COVID response fund for the Kansas City area. And so we're like a conglomerate of area foundations that have put some money together and have been meeting periodically to assess needs and then allocate, the funding over the last couple of years based on those needs assessments and conducting focus groups in the areas of, housing and health and digital equity and some others. And these are spot on with regard to what we've learned about behavioral health, specifically as it relates to workforce shortages, both as, just attraction and retention and any incentives that we can provide through, subsidies or bonuses or signing bonuses, retention bonuses, what have you, to increase the workforce, but also the thought that needs to be put into the behavioral health needs of the behavioral health workforce itself, and how that is lending to the workforce shortage, because everyone is struggling. We've also talked about, and this could be, a marrying of behavioral health and I think it's more K through 12 education, but how we can take some of those behavioral health services into the schools, because the schools are having, huge needs in terms of the trauma being experienced by students as well as, faculty and administrators and what have you. So I think there might be an opportunity there to explore, so long as we're not singularly married to early childhood development in the education space. Pivoting though to away from behavioral health and more squarely into education, just wondering if there's been any consideration made or if there's room to talk about upskilling and reskilling our current workforce as more of an immediate fix with longer term implications for workforce shortages. I totally get the need to focus on early childhood development as, more of a systemic approach that will have long terms, well beyond, many of our lifetime benefit for, educational opportunities and employment opportunities and workforce and what have you. But upskilling and reskilling as a focus area could help to resolve some of our current workforce needs, as opposed to, early childhood development, which won't have, benefits for some years to come in that arena.
Yeah, McLean, one thing I'd mention there is that, when I showed the slide earlier of what's in each one of the advisory panels, we had placed that last point more in the economic revitalization panel. And it was something we heard tremendously about when I looked at what came out of the listening sessions. And I believe that panel was focusing in on that area a lot, but we'll make sure that we maintain a focus on that and coordination
great.
on it.
Thank you.
Sean Sullivan. Hey, my feedback, I think, is more towards what the core focuses are than behavioral health. I would probably agree with what's on here. Was the framework for the behavioral health in particular, but taking a step back from that, and I don't know that anything that was said by John or others would necessarily discourage this, but I want to make sure that we're not discouraging proposals in other possible core areas. So, but with the material that was sent out through the pre-read, there was 120 pages of a slide deck that was primarily only focused on behavioral health and early childhood development. And that does leave out the other areas of health and education and in my area or my world, more senior services, more persons with disabilities, and want to make sure that would ask that we do put some attention on those two areas, and particularly what capacity building possibilities there are with one-time funds. So want to make sure we're not discouraging those proposals with the deadline that's here in a week or two with what was already been sent out, and that it's not just exclusively to behavioral health and early childhood development. So I did want to mention that. And as far as what the possibilities are there, if we could have a similar background, albeit not 120 pages of information as to what funding has been allocated to those to other areas that are not behavioral health, that are not early childhood development, either through stimulus money or through the FMAP 10% increase, the federal Medicaid, Medicare percentage increase that went out to states that allowed for capacity building in certain areas. We could get an overview of that and perhaps what's been done or what other states are doing. That'd be helpful in addition to these two areas that have been discussed this morning.
Yeah, good point, Sean. We can do that, and we will. Just so you know, on the submission form itself, it didn't actually hone in on behavioral health or early child development. So it really just said, is this in the health and education arena? So fine for any submissions that come in from there, and we can work to provide the information as well in the areas that you outline.
Sean, just a comment. In the two populations that you mentioned, persons living with disabilities and older Americans, older Kansans, I certainly hope that we can look at some ways to address the overlap of behavioral health issues in both of those populations, because from my seat as a hospital president, we see a lot of patients in those two populations that have significant behavioral health issues. So I appreciate your comments.
Yeah, I would piggyback on what Sean said, and I'm interested not only in how much other states have spent of their funds on programs, but I really want to hone in on what's effective. It's easy to allocate money, but I want to know the effectiveness of the programs, how efficient those dollars are being used. I think that's important. Also want to key in on, in my experience in education, is these have been issues, early childhood and behavioral health in our public schools has been an issue for a long time. And, what have we done? What of the 28 billion in federal funds since March of 2020 has gone to address this? How effective is that? How can we get that synergy? So just a lot of questions about making sure that we are making the best recommendations in terms of effectiveness of what we're doing and being good stewards of this money.
One thought there, Senator Erickson, is that more does not always equal better, right? And I think in this area, one of the things I didn't mention earlier is that, we've built into the process the thought that each one of the panels might want to bring in expert voices around any of these issues. And so in some of these areas, we have visibility to what people spent and maybe even what they spent it on, but not necessarily results yet. We can try and capture that. But people have been spending money on these areas, per your point, for a long time. And so understanding kind of the best practices, going back even before COVID in some of these areas in terms of what results people are seeing, what they may be applying a more innovative model in some areas. We can try and with you to identify some sources or experts to kind of look at those things too.
Okay, great. Other comments? Discussion? I guess I would just also add that when I look at the areas, the core focus areas, to me, it also lends itself, and I'm glad to see that there's a focus on the importance of the family and providing resources to strengthen that family unit, because to me, some of this or a lot of this stems from families struggling. And if we can help those families alleviate some of those stress points and have the ability and capacity to deal, effectively with making decisions for their children when they're young or meeting their needs so that it doesn't get to the point where we have a crisis. I'm glad to see that that's an area as well.
Well, if that's it for the discussion on just the general discussion, we actually have an exercise that we can go through now with a collaboration board that will allow us to literally create, at least for this session, the areas of focus where we want to focus. So in terms of this exercise, you're getting sent a link to the collaboration board and you'll be able to see it. And we can go through the exercise of being able to say, okay, if an area isn't on the board, let's create it and put it on the board. And then we'll eventually be able to kind of vote each one of the members to understand kind of in aggregate where people, see the most opportunity or need and where to focus going forward. So one thing to note on, I think the first thing we should probably do is in that other column, for instance, if we want to have kind of senior care, we should add that as something there. Anything else that you think, we should be considering.
John, are you ready for us to do our votes?
Not even the votes. I would suggest if people want to add, kind of other tiles,
Okay.
we should add the other tiles in that last column. We can even make it 2 columns, one for healthcare outside of these areas, one for, K through 12 education outside of these particular areas. And then let's start adding, make sure we have all the tiles people think are important before we start voting.
Okay.
Anyone have any other tiles? I mean, Sean, I think you suggested one earlier.
Yeah, I mean, I would add in senior services, disability services, capacity building for both. If I was smart enough to know how to do that, I guess just hit the plus sign.
I can add it in. I'll just type it in. Does that look okay, or anything else you would add to the tile?
No, that works. Thanks.
John, did you want one for each, a box for each, or 2 together?
I would probably separate them.
Okay, keep going. Let's go for about another, say 1103 or 1104. I really want to make sure that we capture all the areas in terms of the tiles we have here before we start voting and discussing. So I'll give it maybe 2 or 3 more minutes, and then we can start voting.
And please let us know if you're not able to see the tool or access it, and we're happy to help you troubleshoot.
looking at the categories for early childhood and behavioral health, can you add capacity building after both senior service and disability services? And then the potential third area would be workforce issues, just general workforce issues. And there are, as obviously here noted, and both the two core areas, workforce and operations, or workforce and operations in both those areas. So I would say, I don't know how to categorize it, but kind of or just general workforce operations.
So what you're saying is for senior services have,
Well, just for,
A,
I guess,
workforce and
all
operation.
healthcare,
Yeah.
not to get too general, but
okay. So just to be clear, the capacity building is just general for all of healthcare?
yeah, I meant for specific to both disability and senior services.
Got it, okay. So there should be 4 boxes here: senior services, capacity building, senior services, workforce ops, disability services.
Although I would just put disability services, capacity building, senior services, capacity building, have those be the 2, and then just general
Okay.
workforce, healthcare workforce.
Got it. Senator Erickson. Let's see. Add literacy, pre-K, and elementary initiatives as a separate category. Great. Anything else before we move on? Going, gone. Okay. Well, in terms of the next exercise, what we wanted to do is, if everyone has 5 votes, you can place those 5 votes against any one of those tiles where the thumbs up is. And you could put all your votes on one tile, or you could spread them out across all the tiles. What we want to do is, for the next 3 or 4 minutes, people vote in terms of where they would place their votes in terms of where to focus for the panel going forward. And then we'll see kind of where most of the energy across the panel resides.
As a reminder, you can vote via the link in the chat by clicking the thumbs up on any of the cards. If anybody is having trouble voting, you're welcome to share your votes out loud or in the chat, and we can add them in.
So I see 15 votes out there so far. So 3 people have used all 5 votes.
A quick reminder that you can vote multiple times for one area. So if there's one topic you feel the most strongly about, feel free to put as many as all 5 of your votes on that card or spread them out across the cards.
What's the password again? I'm having trouble.
Oh, yes, it's 306297.
306
297.
297.
Were you able to access it?
Yes, thank you.
Is anyone else having trouble accessing the tool or any support I can provide getting on there?
Six. So it looks like 4 people have voted. Anyone else still thinking about where they want to vote? Okay, so can we start kind of talking about the results of the voting now?
Sure. I'll just go ahead and sort by votes, John, so it's easier
Sure.
to see what has
Yep.
risen to the top.
Yep. Well, I guess the first thing to note is that in early childhood development, there didn't seem to be, as much of a focus. There was only one thing that got 1 vote, which was, access and availability. Does anyone find that kind of surprising generally? Oh,
My just struggle was I ended up using up all my votes in behavioral health before I got to early childhood.
sure. Well, that's fine. I mean, if that was the area you thought was the most important. Okay, it sounds like there's a little bit more voting going on. All right, we're still sorted.
Yes, this is still sorted by top votes.
Yep. Okay, so it looks like, early childhood development, access and availability, workforce development have some votes now. Behavioral health looks like it's attracted a lot of attention, particularly in workforce development. And then, the additional ones around literacy, pre-K and elementary, senior services, and disability services certainly have added more. I mean, both senior services and disability services, even if you say that some of that may have gotten aggregated a little bit due to the fact that we don't have as many panels, each one of them still has as many votes as the totality of early childhood development. So something to note there. But generally, I mean, I would just open it up at this point. I mean, what are people's thoughts now that they're kind of seeing where this has been coming out in terms of the voting?
My thought would be that we need to just be careful and not add too many areas of focus, because then that just diminishes the amount of money and help we can give any particular one area.
Sure.
I'm not saying that every area doesn't need help. We just want the funding to be significant enough that it makes a difference.
Yep. Yep. Well, one other thing it's telling me is, I mean, we put a lot of data in front of behavioral health and early childhood development. It looks like there are some other areas we should try and bring some data to the table, either in terms of the current situation on the ground, benchmarks, as well as looking what some other states are doing in those kind of three areas to the right. Any other thoughts? Like I said, I don't live in Kansas, nor am I the subject matter expert against any of these. So, all right, well, let's move on and then talk about next steps. And in particular, I'd be interested, as we go through next steps, really spending some time thinking about additional work that the team can do to kind of support the panel, particularly given what was just identified. So go to the next slide. So one thing to keep in mind is that the submission template is still out there through the 16th. Once again, for any submissions in the health and education area. So, if you think there are some groups that want to submit ideas, or you think you want to submit some ideas yourself, feel free to go there. So that's still out there. The thought would be that as the advisory panel continues to brainstorm on, the most important areas of focus, and part of that would be actually seeing submissions that come in and can work, and potentially even group some of them around themes. We would try and portray them all in a similar way to what is in the submission form, once again, just so we can make some apples to apples comparisons and have kind of a common data set. Go to the next slide. So in terms of, and I talked about this a little bit earlier, there will be resources available to all the panelists. We've created a Microsoft Teams folder for each one of the panels. I believe this is a live link on the document, but also we'll follow up with all of you with a number of things. One of them will be a link to the site, and that will have on a weekly basis, thereabouts, we're going to kind of download, here's what we're seeing in terms of submissions for each one of these panels. So you'll be able to see what's being submitted, as well as other resources in terms of recordings, documents, data, both, what's been created to date and what's been created in any areas we decide to focus on going forward, as well as identifying the resources for the advisory panels and the information around how to kind of reach out and connect with those folks. Next slide. So once again, this is just the kind of first step in the process of getting some level setting around the current situation from a data standpoint. And also really to start getting the panel itself thinking about the areas to focus on. Like I said at the beginning, one of the things that makes this area maybe a little bit unique from some of the others, like connectivity, is that this is just such a broad, realm to play in across education and healthcare. So it was pretty important to really find the areas we wanted to focus in on. And what we got today was pretty helpful on that end, as well as a lot of the things in these areas from allowability standpoint, are pretty much square in the focus of the Treasury allowability. The challenge in some of these areas, given the guiding principles of the Spark Executive Committee, is to be able to kind of craft solutions in a way that are more kind of one-time catalytic investments, as opposed to kind of creating an ongoing, budgetary requirement. That would probably be the challenge for a lot of the solutions that we come up with as we think this through. Next slide, in terms of, what we're going to need, what we'd like for before next time. Generally, we probably want to schedule the next session, which will be much more around brainstorming individual ideas. So today it was much more just kind of let's level set and begin thinking about areas of focus. That'll probably happen in the middle of February or so. We need to work with the chairs to kind of nail down that time. But in the interim, review the process overview, pre-reads, fact packs, any other shared materials. You can individually brainstorm, gather ideas from relevant stakeholders around those areas. Certainly encourage people to submit. And then also let us know, one, if there are some experts that you think we should bring into this process, and they could either be brought into the process in future meetings, or we can have separate webinars, for people who are interested in them, as well as to think through here are areas of additional analysis that you would like to see, or additional support from the support team going forward. Next slide. And so in the next meeting would largely be around sharing the early themes from the submission. So we'll be able to provide those to all of you through the panel team site before that, and then doing brainstorming and discussing additional investment ideas. So the key topics will be previewing key themes from the submissions, brainstorming additional ideas, and to Senator Erickson's point, not even just maybe even transformational ideas as well as incremental. Let's look at, kind of what's working well, in other states. So it's not just a matter of just the amount of funding, but, how you're applying the funding, and align on some key investment ideas to build out as we continue and begin to review some of the filtering criteria. So as we continue to flesh out and generate the ideas, thinking through, well, how do we want to filter them so that we really get to focus on the ones that we want to score, the ones that are going to be the most viable. In terms of preparing, complete the meeting survey. I'll talk about that on the next slide. Once again, continue to review the overview, share ideas for experts. And I guess one thing I would say as well is right now, let's spend a minute, what are some, just to make sure that, we're supporting you as well as possible. Some of the specific, I think I mentioned some of them, but you may want to kind of stress them, areas where you would like to see some additional data being brought to the table that we could bring to the panel even before the next session that would be helpful. So I'd open it up to get people's thoughts on that, just to make sure we capture everything.
I would reiterate just kind of the additional areas that have been noted with senior and disability services, with a similar exercises, what you went through with early childhood and behavioral would point you to a senior care task force that has been working on some of these things the last number of months. If you can interface with KLRD staff who could provide you a summary of some of those info and material data that they've looked at, that might save some time.
Great. Anyone else? Any particular of expertise in terms of best practices in these areas across states? I think someone had mentioned to me in the past was the Arnold Foundation is a example of a group that is a clearinghouse for best practices. Anyone else have any suggestions? Oh, okay, next slide. And so once again, this is an exit survey that we'll send a follow-up on this as well, that we'd like to get people's thoughts around anything we can clarify, any additional work that we can do, even before the next session, any other experts that we can bring into it, anything we can improve, just kind of let us know, but kind of this is it in terms of the formal stuff we wanted to go through and have discussions around this session. I don't know, I open up to the chairs, Robin, Senator Erickson, any kind of thoughts now that we've kind of gone through the materials for the kickoff?
Honestly, I think that what you've provided us with has given us a lot of food for thought, a much better understanding of, our roles and responsibilities going forward. So I'm just looking forward to our next meeting when we can start brainstorming on the actual proposals that we can have.
Right.
John, I do have another question. As proposals are sent in, are we going to get those in real time? I believe that there might be some time sensitive proposals headed our way or that have already been submitted. So how are those going to be handled from a logistical standpoint?
Yeah, what we were going to do was probably at least on a weekly basis, make sure that we kind of look at all of them and kind of are able to get them, kind of load them into the panel site. So it wouldn't have been a real time into the feed basis. But we just wanted to kind of get a chance to kind of check some of them just to make sure that, they were all kind of generally in line with the submission approach. So, but certainly there would be a download, our intent, or one or two downloads before or updates of submissions into the team site before the next session.
John, you probably have seen the proposal from Kansas Hospital Association regarding the Kansas Hospital Decompression Plan. It came last
Yes.
week.
Yeah, I talked with someone about it and suggested that they look into submitting a proposal. I haven't looked at the proposal.
Okay, that one, as Senator Erickson just used the phrase time sensitive, is one that is very time sensitive.
Mhm.
I think we all, whether you work in healthcare or not, if you pay any attention to the news, recognize that hospitals are extraordinarily tight on beds, and we are transferring patients from Kansas communities to New Mexico, Colorado,
Mhm.
all kinds of states far away from us. And so this request is for funding to work with a group that has done a similar plan in Nebraska,
Mhm.
decompress Nebraska hospitals. They're asking for funding for 13 weeks. Hopefully, by the time we get through this whole multi-month process, hospitals will already be decompressed.
Mhm.
But to wait for this proposal to go through that whole process will not be of much help to them. So I wasn't sure what the process would be to look at time-sensitive, more urgent needs.
Yeah, I mean, this process really was meant to have an integrated view of things. We'll probably just need to talk with the chairs offline about that. I remember when I had heard about that particular one, had wondered whether there are any other sources of funds that might be in a position to be able to support that. But let's discuss that offline just to understand
Okay.
the situation better. Anything else? Any other thoughts from any other panelists before we sign off?
Wanted to briefly note that the exit survey link is in the chat. And if folks are able to just spend a few minutes filling that out before their next commitment, that would be very helpful.
Is it possible for that link to be emailed out to us?
Yes, we will also email it out at the end of the meeting.
Great. Well, thank you very much for your time. Like I said, it's incredibly important, and it's a pretty fast pace. So appreciate everyone making the time and committing to be part of this process going forward. And we'll see you in the next session. Thank you.